There are 2 new cases of Covid-19 to report from managed isolation facilities in New Zealand today. The first case is a man in his 20s who arrived in New Zealand on 19 June. He flew in from India on Air India flight 1316. He has been staying in managed isolation at the Pullman Hotel and now, as is our protocol, being moved to the quarantine facility, which is the Jet Park Hotel. The second case is a man also in his 20s who arrived in New Zealand on the 18th of June from the US of A. He was on flight NZ5 from Los Angeles. The man tested positive at the Jet Park Hotel after showing respiratory symptoms. Now, he had been at the Jet Park Hotel from his arrival. I understand there was a mix-up at the airport and he got in the wrong group, so he ended up going to the Jet Park. So he's actually been at the Jet Park since arriving, became symptomatic and was tested as a result. So actually both of these cases were picked up at our now routine testing at around day 3. In the second case, as you'll note, the man was also symptomatic. I can also say that one of the cases who has been in isolation in the Wellington region, in the Hutt Valley, is now considered recovered, and recovered being at least 10 days since onset of symptoms, at least 48 hours asymptomatic, and a negative test. So the total number of active cases in New Zealand is 10. Our total number of confirmed cases now is 1,165. And we still have the one significant cluster open. This is the one in Auckland at St Margaret's, but obviously no cases as a result of that cluster for some weeks now. Yesterday there were 4,303 tests processed at our laboratories around the country, and our total completed to date is 348,822. Just some comments on our testing as part of our border measures. So since June the 9th, we have rolled out the testing in managed isolation facilities at around day 3 and around day 12 of people's stay. There's been some suggestions in recent days that we should be testing people on arrival at the border, possibly as a third test. What we do at the border when people arrive, everybody arrives, is a health screen, a series of careful questions that they respond to, and anyone symptomatic at that point goes straight to the Jet Park facility and is managed as a symptomatic person and tested as part of that management. Anyone who is not reporting symptoms goes to one of the other managed isolation facilities. The reason we don't test on arrival and we wait till day 3 of the managed isolation is because that is about day 5 of many people's journey from wherever they have come from into New Zealand. And we know that testing then is more likely to pick up infection than earlier testing when people may be incubating the virus but not test positive. So that's the reason for the testing around day 3 instead of at the border. And likewise, the testing at day 12 provides extra security. First of all, because the tests do have a false negative rate of somewhere around 20 to 30%, but also it's part of our departure planning for people to make sure they do have, we can confirm that they don't have the virus. Now, I've talked before about the fact that these people who get positive tests quite late in the illness, there have been studies done in both Singapore and South Korea of these people who get a positive test. So the virus is detectable, but it's seems very clear from those 2 studies that they're not actually infectious. The testing, though, if it is positive at day 12, means that people's visit is prolonged until we can be certain that they are recovered. Okay, a follow-up on the context that we have been, or the follow-up of people following the 2 cases last week that came in on Tuesday, that were identified on Tuesday. So there are 3 groups of people. First of all, the 55 who had left managed isolation on a compassionate exemption between the 9th and 16th of June, and they either went to self-isolate under very strict criteria in the community, or they were on day a leave to go and make visits, for example, to hospice or hospital. And as of yesterday, we had one person who hadn't been located. That person was located yesterday afternoon, and testing's been arranged there. The next group we followed up, of course, was anyone who had interaction through the Novotel. There were all the people who were there. They've all been tested. There were staff as well who were working there, and there were then people who had been at the hotel, the Novotel, between the 6th of June and the 13th of June when the two women from the UK travelled down to Wellington. Yesterday we had 11 people that were outstanding of that 190, and of those 5 have now been further contacted and referred for testing. 3 have a community worker visiting this morning, and there are 3 where we're still working to contact those people, and we're using our finding services to ensure that we can make contact with them. And in terms of the staff at the hotel, of the 11 that were outstanding yesterday, there's only 2 that remain outstanding, and the hotel is following up with those. They will be tested as well. Then the next group, which was our really trying to cast the net wide, is to follow up everyone who left managed isolation from other facilities between the 9th and 16th. So as of last night, we had identified there were 2,159 people in that category. I should say that does include the people who had exemptions and the people who were at the Novotel for some of that period. As you will recognise, the dates don't quite match. The Novotel was the 6th to the 13th. So that figure of 2159 is we've got from Healthline, because they're all the people who they were doing call-in checks to check on their welfare 3 times during their visit. Now those calls are in addition to the daily health checks by the nurses. That's more about welfare, planning for when they leave, making sure they've got accommodation and support. All those people, the ones that I haven't talked about already, have of course completed their 14 days isolation, which has been and remains the most important part of the border safety. They all received health screening on departure, and testing was offered. So work is ongoing to make contact with all of the people in this group. In terms of getting in contact with them, they get a text, they get a call. There are 4 follow-up calls, and if we don't get a hold of them, then we use our finding services, which includes customs and police, to get an address from their database, and then if necessary, like we did with the person yesterday, we'll send either a health provider around, one of our local health providers, and or we can use the police if necessary to locate them. Work is ongoing with that group, and just to reiterate, these are all people who have spent the 14 days in self-isolation, in managed isolation, and we are just following up as a final precaution with them all. All of those people will have received contact, or there will have been attempts to contact them. Sometimes the phone numbers are phone numbers offshore, so they're international cell phones, and the calls don't go through. But if anybody in that group hasn't yet been contacted, then I'm asking them, as I did yesterday, there's a dedicated number with a dedicated Healthline team, 09 302 0408. And as you'll recall, prior to the 9th, when we started to introduce the double testing, everybody had completed 14 days and then gone out into the community, and that remains the mainstay of our efforts to prevent importation of cases into the country. And I guess I'd just like two more comments to finish. New Zealand is one of a very small number of countries that not only includes the 14 days mandatory isolation, managed isolation, but also the double testing before people are allowed to go out into the community. This is first of all consistent with international evidence about that 14-day period, and that once people have completed the 14 days, they pose a very low risk to the community. Even if they might still have virus detectable, it does not mean they're infectious. And often the comparison is made, for example, with the jurisdiction of Taiwan, which has got a very good process for people coming in. But I should say that is not a managed isolation process. That is people self-isolating at home with community follow-up, very good, strict follow-up. So we're, as I say, one of very few countries that do that. And finally, a question that has been outstanding for the last few updates, a homeless person who apparently spent some time in managed isolation in Auckland. As far as we can tell, this cannot be verified and may well be an urban myth. I'm sorry to disappoint you there.